Hi, everyone. I'm going to go through how to access the interpreter via your computer. So I'm showing this slide that tells you if you're looking at your screen, you can go to the interpretation icon, click the language that you would like to hear, and then after you've done that, to only hear the interpreted language, you can click Mute Original Audio. And then to access interpretation via your computer, you can go to your meeting webinar controls, click Interpretation. Oh, this is the computer again. Did I already do computer? Mobile phone, sorry. To access interpretation via your mobile phone, go to Meeting Controls, tap More, tap Language Interpretation, choose your language. Then you can choose to mute the original audio and click Done.
Para que los que necesiten interpretación en español, para acceder a la interpretación a través de su computadora, primero en el control de seminarios web, haga clic en interpretación y luego haga clic en el idioma que desea escuchar, por ejemplo, español. Y si solo desea escuchar el lenguaje interpretado, haga clic en silenciar el audio original. Y para acceder a la interpretación a través de teléfono móvil, primero también en el control de seminarios web, haga clic en los 3 puntos que ve abajo, haga clic en la interpretación y haga clic en el idioma que desea escuchar, por ejemplo, español. Y si solo desea escuchar el lenguaje interpretado, haga clic en silenciar el audio original y haga clic hecho Done.
Okay. Hi, everyone, and welcome to Medi-Cal Updates and Strategies for Families. I'm Elizabeth Zerker, a Senior Counsel with Disability Rights California for our Healthcare and Home and Community-Based Services Practice Group. And I'm here with Anna Leach-Proffer, who is the Managing Attorney for our Home and Community-Based Practice Group. And I'm also happy to be here with Daisy Dominguez, who is a parent advocate who's going to share her expertise with you all as well.
Hola, buenas tardes. Hoy vamos a hacer las actualizaciones de Medi-Cal y estrategias de familia. Hoy con nosotros está Anna Leach, Elizabeth Zerker y la consejera del Medi-Cal.
Thank you. And then I'm going to just add this disclaimer, which is that the following presentation is meant for education only and does not constitute legal advice or counsel. Your situation may be unique and require careful attention. And please keep in mind that the information in these slides could become out of date as the laws and local practices relating to these matters are constantly developing.
Sí, descargo de responsabilidad. La presentación es para educación solamente y no constituye consejo legal. Su situación puede ser único y puede requerir atención cuidadosa. Mantenga en mente que la información en esta presentación se puede cambiar y que las leyes y prácticas
Okay, so Disability Rights California is a nonprofit organization that serves people statewide. We provide advocacy and legal services to Californians with disabilities, including those with special healthcare needs, on a wide variety of issues, including housing, employment, and special education. Our team advocates for home and community-based services, primarily for people with Medi-Cal. This includes helping people access Medi-Cal programs like the In-Home Supportive Services Program, Medi-Cal Waivers like the Home and Community-Based Services for Developmental Disability Waiver, and the Home and Community-Based Alternatives Waiver. We also assist with accessing services through the California Children's Services Program and through Medi-Cal Managed Care Plans. Today, we are going to talk about Medi-Cal strategies for families, We'll start with an overview of the pathways to eligibility for Medi-Cal and a discussion of why Medi-Cal eligibility is important for children with special healthcare needs. We'll talk specifically about EPSDT and the services offered through that program. And then we will discuss Medi-Cal waivers, other Medi-Cal programs, and provide basic information on the Medi-Cal appeals process. And I'm going to turn it over to Anna now.
Thank you. Good afternoon, everyone. As Elizabeth mentioned, my name is Anna Leach-Proffer, and I'm managing attorney with Disability Rights California. Happy to be here with you all today. I'm going to start us off with some quick basics on Medi-Cal eligibility, and then talk about why Medi-Cal eligibility is important for children with special health care needs, even for those who may have other health coverage, including commercial or private insurance. So Medi-Cal is California's Medicaid program. Medicaid is a federal and state program that helps cover healthcare costs for people with limited income and resources, and people with disabilities and special healthcare needs. In addition to providing comprehensive coverage, like any health plan would, Medi-Cal offers benefits not typically covered by private insurance or Medicare. It includes things like nursing home care, in-home nursing or private duty nursing, and personal care services to assist with activities of daily living. Here in California, those personal care services are often provided through the in-home supportive services or IHSS program. So I'm going to talk about 4 main paths to Medi-Cal eligibility. The first is what's often referred to as MAGI Medi-Cal, which stands for Modified Adjusted Gross Income Medi-Cal. This program was created as part of the Medicaid expansion in the Affordable Care Act. This program considers only family income as reported on taxes, and it does not include consideration of resources or have asset limits. Children under 18 are eligible for MAGI Medi-Cal if family income is below 266% of the federal poverty level. So there's a much higher income allowed for children than for adults, which are at 138% of the federal poverty level. For some perspective, the numbers for 2024 for a family of 4. A child under 18 would be eligible for MAGI Medi-Cal with an income anything less than $82,992. And for a family of 6, it would be eligibility for children under an income of about $111,000. And we'll be sharing the slides after the presentation. We do have links to a chart for all family sizes that folks could refer to. The second path is non-MAGI or traditional Medi-Cal eligibility. And these are programs that cover individuals of all ages with disabilities up to 138% of the federal poverty level. Now, just for comparison, for a family of 4, that would be about $43,000 for 2024. These programs used to have asset limits, very tight asset limits of only $2,000, but those asset limits have been completely removed as of January 1st, 2024. So there's no longer an asset limit for those programs, which include things like the Aged and Disabled Federal Poverty Level Program, the Medically Needy Program. But for those programs, as for MAGI, parental income is imputed to children. And if you notice, this has a lower income limit than the Modified Adjusted Gross Income Medi-Cal program. The third type of eligibility for Medi-Cal that I want to mention is SSI-linked Medi-Cal. And this one is really just as simple as it sounds. Children and adults who receive SSI automatically receive Medi-Cal linked to that SSI. And that brings us to the fourth path to eligibility that I want to mention, and one that ties into a topic that Elizabeth's going to discuss a little bit later in the presentation. That fourth path is eligibility through what's referred to as institutional deeming. So institutional deeming is when children are treated as though they are in a hospital or facility, even though, and this can occur even when they are living at home. So different income counting rules apply. What this means is that when a child is institutionally deemed, the parents' resources and income are not considered, and they can be eligible for Medi-Cal based on just the child's own income, which is generally quite low. One type of income a child could have of their own would be child support, and there are specific rules on how that is counted. That we can share links to information about that. But children can receive institutional deeming when they are in a hospital or other facility, or when they're enrolled in a home and community-based waiver, including the DD waiver, which is coordinated through the regional centers, or the home and community-based alternatives, or HCBA waiver. Now, Elizabeth will be speaking in more detail about sort of each of those waivers later, but one of the benefits that children can get by enrolling on one of those waivers is institutional deeming, which will allow them to access Medi-Cal even if their family income would otherwise be too high. Next, I'm going to talk about sort of why Medi-Cal eligibility is so important for children with special health care needs. And the main reason is for the added services and protections that come along with it relative to what is typically available through commercial insurance coverage. And so these protections are often referred to as EPSDT protections. So what EPSDT stands for is early and periodic screening, diagnosis, and treatment. But what it is in practice is a comprehensive array of prevention, diagnostic, and treatment services for children and young adults under 21. Now, the EPSDT benefit provides more robust services than the general Medi-Cal benefit for adults. And it is designed to ensure that children receive early access to appropriate care so that health problems are treated as soon as possible. The goal really overall of the EPSDT protection is that individual children get the specialized healthcare and other services that they need, and they get those services when they need them. Next, I want to talk a little bit about how EPSDT works and what it does. So one of the things it does is it ensures that a robust set of screenings take place at regular prescribed intervals and also are available when any problems arise. So a diagnosis might occur following a regular screening visit or as a result of a request from a family member or caretaker when an issue is noticed, the child's development or other symptoms. The treatment available once a condition is identified should include any service that can be covered by Medi-Cal and is necessary to correct or ameliorate a child's condition or illness. So I'll talk a little bit about in the next slide what this correct or ameliorate standard means, but it really is sort of these magic words that mean that children and young adults under 21 in the Medi-Cal program have access to more services and a more favorable medical necessity standard. So under EPSDT, states are required to provide comprehensive services by covering all appropriate and medically necessary services needed to correct or ameliorate health conditions, even if those services are not included in the Medicaid state plan. So what the state plan is a document that basically outlines all the services that are available to the entire Medi-Cal population, or the entire adult population in the Medi-Cal program. So the services available under EPSDT go beyond what is included in the state plan. Additionally, states are required to inform all Medicaid eligible individuals under age 21 that EPSDT services are available. So that notice is typically given in sort of routine notices when an individual enrolls and as part of the recertification process each year. Now I'll talk about what those magic words correct and ameliorate mean and why they're so important. This standard is a big part of what makes access to Medi-Cal and EPSDT protection so valuable. It essentially means that a child should get what they need. So this includes physician, nurse practitioner, and hospital services, physical and occupational therapy, speech therapy, home health services, in-home nursing or private duty nursing, and durable medical equipment and supplies. So things like wheelchairs, ventilators, ventilator tubing, G-tube supplies, that type of thing. Now, additionally, this protection includes treatment for behavioral health and substance use disorders, treatment for vision, hearing, and dental diseases and disorders, and much more. And what's important here is that unlike the adult medical necessity standard in the Medi-Cal program, in order for a service to be approved through EPSDT, it does not need to cure the condition. The services that help to maintain or improve a child's current health condition are also covered because they are considered to ameliorate the condition. And maintenance services, which are defined as services that sustain or support rather than those that necessarily cure or improve health problems. So things that keep the condition from further deteriorating, those are also covered services, even if they're not necessarily improving the existing condition, which would be the standard when you're looking at adult medical necessity. So, okay, now that I've given the intro information on paths to Medi-Cal and why Medi-Cal is important, I'm going to turn it back over to Elizabeth to talk about Medi-Cal waivers, and then I'll be back later on in the presentation to talk about Medi-Cal appeals. Elizabeth?
Thank you, Anna. So I'm going to cover California's Medi-Cal home and community-based services waivers, which are also known as HCBS waivers, as well as other HCBS programs, which are not waivers. I'm going to start with some technical information about Medicaid, which is called Medi-Cal in California, and what services people can get and why. So if a state chooses to participate in Medicaid, the state must offer mandatory services, which include access to care in a hospital, nursing facility coverage, doctor's visits, among other things. And when states participate in Medicaid, states receive federal financial participation, or FFP, and match those federal dollars with state dollars. In some cases, states receive a higher percentage of the cost from the federal government. States can also choose to offer optional services like physical and occupational therapy, dental services, personal care services. In California, for instance, in-home supportive services. And altogether, those mandatory and optional services make up a state Medicaid plan. State plan services must be available statewide and to all people who are Medicaid eligible. Next slide. So what's the difference between state plan services and waiver services? A Medicaid waiver is a written approval from the federal government, reviewed and determined by the Centers for Medicare and Medicaid Services, CMS, that allows states to differ from the rules of the standard federal Medicaid program. I'll talk a little bit more about this later, but basically a waiver waives certain requirements that normally optional and mandatory state plan services must comply with. States can request home and community-based services waivers to meet the needs of people who want to receive long-term care services and supports in their home or community instead of an institutional setting. And I'm going to focus on 1915C waivers in this presentation, but Medicaid provides for a variety of different kinds of waivers, including 1115 research and demonstration projects and 1915B waivers. For example, CalAIM is operated under an 1115 waiver. Next slide. So Medicaid was signed into law in 1965 alongside of Medicare, and home and community-based services first became available in 1983 when Congress added Section 1915C to the Social Security Act, giving states the option to receive a waiver of Medicaid rules governing institutional care. Waivers can waive 3 Medicaid requirements. So comparability of services. That means it allows states to make waiver services available only to certain groups of people who are at risk of institutionalization. For example, states can use this authority to target services to seniors, technology-dependent children, people with intellectual or developmental disabilities. States can also target services on the basis of disease or condition, for example, traumatic brain injuries. Waivers also can waive statewide-ness. So that lets states target waivers to areas of the state where the need is greatest or where certain types of providers are available. And finally, waivers can waive rules around income and resource rules. And this lets states provide Medicaid to people who would otherwise be eligible only in an institutional setting, often due to their income and resources of a spouse or a parent. And Anna talked previously about institutional deeming, which is what happens through a 1915C waiver. Next slide. What does this mean in practice? It means that there can be wait lists for services under a waiver, and it means that there can be caps on the number of people who can receive services. There can be geographic limitations. On a positive side, it allows for institutional deeming. So you essentially protect, it's the idea that someone is treated as if they are in an institution when they are actually in the community. And this applies to both spousal impoverishment protections, which is where the income of the spouse who needs Medi-Cal, who does not need Medi-Cal, is not counted in the equation for eligibility. And it also does not consider the income and resources of a parent in the case of a child who needs Medi-Cal but has family income that would otherwise preclude access to Medi-Cal eligibility. Next slide. So there are 6 current 1915C waivers in California. Information about target populations in the service areas is on this slide. I'll just note that the home and community-based alternatives waiver and both of the waivers that serve regional center eligible children and adults are statewide. Slide 18, which waiver? This I think is no longer quite as confusing because the home and community-based alternatives waiver has existed for a while now. But it's just important to know first that you cannot be on 2 waivers at once. Just a note, a technical note that doesn't, that's sort of different for CalAIM and the 1115 waiver, but for the 1915C waivers, you cannot be on more than 1 at the same time. In the past, the Department of Healthcare Services and the Department of Developmental Services allowed people to be on 2 waivers at once. Now, if your child or if you are still on 2 waivers, you will need to choose. There are some similarities between the waivers. There's a helpful chart on the Department of Healthcare Services website that goes through which waiver you might want to consider. And people often refer to being on the waiver or the HCBS waiver, but there are differences. And one way to know which waiver you are on is if you are working with a waiver agency, you are on the HCBA waiver. If you're working with your regional center service coordinator, you're most likely on one of the two regional center consumer waivers, and I'll talk a little bit more about them in a minute. All right, next slide, please. So the first waiver for regional center consumers is the HCBS waiver for individuals with developmental disabilities. The HCBS-DD waiver serves regional center clients who meet an ICF level of care, and unlike the HCBA waiver, there is no limit on enrollment. Although the current waiver cap is set for up to 179,000 individuals, the state will increase capacity as necessary. So there's no waiting list issue with this waiver. Because the HCBS-DD waiver is a 1915C waiver, participants are eligible for institutional deeming, which again means the parent's income and resources are not counted in the child's Medi-Cal eligibility. You do not have to be on the HCBS-DD waiver to receive regional center services. But if you're interested in being on this waiver, the first step is speaking to your child's service coordinator and asking to apply, because the regional center is the first step in the process of applying for the HCBS-DD waiver. Next slide, please. So the next HCBS waiver for regional center consumers is the self-determination waiver program, which is relatively new. It allows participants to self-direct both services and their budget. And effective in July 2021, after a pilot period, the program became available to all eligible regional center consumers. It also offers institutional deeming. I'll note that according to the Department of Developmental Services, if you're interested in self-determination services, you do not necessarily have to be on the self-determination waiver. So more information is available at the bottom of this slide. There's a web link. And next slide, please. So the Home and Community-Based Alternatives HCBA waiver. This is open to children and adults of any age who meet nursing facility level of care or higher. In 2024, the capacity for this waiver is 10,774. The current waiting list is 4,762. And I'll talk a little bit more about how the department is managing the waiting list, because children are a priority group among that waiting list. And what we're seeing is that children are getting processed off of that waiting list. We have a publication that goes through services available under the waiver, and that's linked right here. Next slide. It used to be that there were individual levels of care and individual cost caps for this waiver, and that tended to make it very difficult for people who had disabilities that didn't fit right into the definition of a certain level of care. However, the Department of Healthcare Services has eliminated those individual cost caps. So services are now authorized based on the person's need and as approved by their doctor in a plan of treatment. There's still levels of care within the waiver, but those govern the intensity and frequency of care management. And there's no money limit for services in a plan of treatment. So that's a big change for anyone who remembers when the waiver had those individual cost caps in the past. So there are a variety of services available through the waiver, but I want to clarify what is sometimes confusing from a participant perspective. What you really get from the waiver agency who manages your waiver services is comprehensive care management. Your waiver agency processes an application, develops a plan of treatment, and authorizes delivery of those services that are on the plan of treatment and listed here. So facility respite, family caregiver training, medical equipment operating expense, personal emergency response system, private duty nursing, including home health and shared services, transitional case management for medically fragile and technology-dependent individuals of any age. And I'd like to just note here that while the waiver gives access to services like Waiver personal care services and others of the next slide as well, if you're a child receiving EPSDT nursing, you're eligible for that EPSDT nursing whether or not you're on the HCBA waiver. So the waiver is not the waiver is the pathway to Medi-Cal and EPSDT for children who are otherwise not income eligible. But if you're income eligible for Medi-Cal and you're on the waiting list for this waiver, just wanted to flag that your child is still eligible for EPSDT nursing because that is their right under EPSDT. It's not triggered by the HCBA waiver. Next slide, please. So in addition, case management and coordination, habilitation, home respite, waiver personal care services, community transition, continuous nursing and supportive services, and environmental accessibility adaptations. One very important service for waiver participants is waiver personal care services. It's similar to IHSS, but doesn't use the same authorization process. It's critical for many people who need personal care services above the 283-hour a month IHSS maximum. It can bridge the gap between that 283 hours and 720 hours a month, which is 24-hour care. How do you get waiver personal care services? You must already receive IHSS, and your waiver personal care services will be determined after your IHSS hours are determined. Waiver personal care services do not replace IHSS, but are more flexible. Of note, in the past, you could not be a waiver personal care service provider if you were the legally responsible relative of the recipient. During COVID, that rule was relaxed, and post-COVID-19 flexibilities now, you can be a parent or spouse provider of waiver personal care services if you show an extraordinary care need. For a minor, care is considered extraordinary when the need is based on a functional impairment due to the minor's disability and the type of assistance needed is beyond what would normally be expected for a minor of the same age without the functional impairment. There's a link to the policy guidance around parent and spouse providers of waiver personal care services. And I'll also note that IHSS overtime rules also apply to WPCS. And so there's a link to a publication about what those overtime rules are. Next slide, please. So how do you apply to the HCBA waiver? The HCBA waiver is administered by waiver agencies. So DHCS has an integrated systems of care division, which is over these waiver agencies. They are across the state, and which waiver agency you would apply to is based on what county you live in. In Los Angeles and some other Southern California counties, it's actually even more granular. You need to figure out which waiver agency you would apply to based on your zip code. All of that information, though, is available on the website linked here. In some counties, the waiver is administered not by a waiver agency, but directly by Department of Healthcare Services. And those are Alpine, Imperial, Inyo, Marin, Mendocino, Mono, and Napa counties. Next slide, please. So unfortunately, in July of 2023, the HCBA waiver abruptly had to stop enrollment due to reaching capacity. The Department of Healthcare Services is releasing approximately 150 slots statewide per month based on an increase in capacity of 1,800 slots starting this year, 2024, and adding 1,800 slots every year through the term of the waiver, which is through 2027. So even though there is a waiting list, if you think that you need services from the HCBA waiver, you should apply as soon as possible. DHCS has issued guidance about how the waiting list will be managed, and different priority groups have been established. So the first are individuals who are transitioning to the HCBA waiver from a similar waiver because of their skilled care needs and their level of care can no longer be met in that waiver that they are in. That's the first priority category. The second is individuals under 21 years old with priority first to children who are almost about to age out of EPSDT or who aged out of EPSDT within the previous 6 months, who have or had been receiving private duty nursing at the time that they age out of EPSDT. Then individuals who need institutional deeming to access Medi-Cal, and then all other individuals under 21 who don't meet the criteria in the first two numerals. Next slide, please. So the C and D priority populations are mainly adults, individuals who've been living in a skilled nursing facility or acute facility for at least 60 days, and then individuals in the community. We really recommend, particularly if you have a child who is aging out of EPSDT, that you apply for the HCBA waiver if you have not done so already or are not on the waiver or one of the two DD waivers. This is because once your child is an adult, if they need nursing, they will not be able to access nursing through regular state plan Medi-Cal because that is not covered for adults in the community. And I think there's lots of discussions about how to, ensure children who are aging out of EPSDT and CCS get what they need, but really want to flag that this is critical given the waiting list now to get an application in early because, if your child is aging out in a year, an application should be put in right now. Next slide, please. So other relevant non-waiver programs include in-home supportive services. Next slide, please. So IHSS, statewide program available only to individuals with Medi-Cal, serves adults and children with the goal of helping them remain safely living at home, provides basic services to individuals who cannot perform those services themselves, like personal care services, assistance with meal prep and feeding, provision of paramedical services, including administering medication. It also provides protective supervision. The monthly maximum I mentioned before is 283 hours per month. Tomorrow, two of our colleagues will be presenting a breakout session devoted entirely to IHSS and WPCS, which will explain how to apply to IHSS, the types of services available, and how to become an IHSS provider for your child. Of important note is that as of February 19, 2024, parent-provider rules no longer apply in the IHSS program. This is a huge change in flexibility for parents because parents are no longer subject to the complicated rules around when a parent or a non-parent can be a provider. So if you're somebody who had a non-parent provider because you work full-time and can't be the provider for your child, those rules have changed and you can be the provider for your child now. So this is a very big flexibility and we really want people to be aware of it. And there will be more information about that tomorrow. Next slide. So I hope that many of you were able to join the plenary session this morning discussing CCS. And because it was discussed, I'll just give a brief description. It's not technically a Medi-Cal program, but more than 75% of kids with CCS also have Medi-Cal. CCS provides diagnostic and treatment services, medical case management, and physical and occupational therapy services to children under age 21 with CCS eligible medical conditions. And examples of CCS medical conditions include, but are not limited to, chronic medical conditions like cystic fibrosis, hemophilia, cerebral palsy. CCS provides specialized case management and access to CCS paneled specialists, provides medical therapy services that are delivered at public schools, and it has income eligibility requirements, but those requirements are waived for kids with full scope Medi-Cal. So if your child has Medi-Cal through a waiver, you will also not need to meet CCS financial eligibility requirements. And I will now back over to Anna for Medi-Cal appeals.
Okay, great. So next we're going to move on to talking about Medi-Cal appeals. So of course, our hope, and I'm sure the hope of everybody on this call, is that everything goes smoothly, and anytime you or your child need a service through Medi-Cal, it gets approved and you get access to it in a timely manner. Unfortunately, we know that doesn't always happen. So I want to talk a little bit about what the process looks like when a service is denied. So anytime that Medi-Cal denies, terminates, or reduces a service, they're required to send a written notice of action. And what that notice of action does is it explains the reason for the negative action and provides information about the process for appealing or challenging that denial. So first, I'll discuss how to request a hearing. So there are some slight variations between the hearing process for various Medi-Cal programs, but all Medi-Cal and CCS hearings are currently administered by the California Department of Social Services through their State Hearings Division. I'm going to talk about the number of ways to request a hearing. Again, all of this information should be provided as part of a written notice that you get anytime there is a denial or a reduction or termination of a service. But just quickly to go through it. So there are a number of ways to request a hearing. You can submit a hearing request online. This is done through the ACMS system, which you can either create an account or you can submit an appeal through the system using the link here without creating an account. Now, for me, for most advocates, this is a preferred method of requesting a hearing because it creates a nice paper trail of when the hearing was requested, and then you have a way of tracking any documents and uploading any documents related to the hearing, viewing information in real time or close to it about when the hearing is scheduled, and you get that real-time confirmation of your hearing request being accepted and processed. So I think it's really nice, if possible, to submit the hearing request online. The hearing requests also can be submitted in writing by written letter to the California Department of Social Services, or by calling the State Hearings Division. And they have a 1-800 number that you can call and handle any hearing requests or basic questions about hearings. Now, the type of hearing, so if you don't specify, the default will be a telephone hearing, but you can request a video hearing or an in-person hearing depending on your preference. It is, so the person requesting the hearing is often referred to as the claimant. So it's the claimant's choice what type of hearing to have. And to my next slide here, talk a little bit about the timelines for filing appeals. So generally speaking, in the Medi-Cal program, you have 90 days from the date of the notice of action to file your appeal or hearing request. So for IHSS appeals, 90 days applies for appeals in the fee-for-service Medi-Cal system or any appeals related to waiver services. That would be 90 days. Now for disputes involving Medi-Cal managed care, they have a slightly different appeals process. There's a two-part process for those appeals. The first part of the process, you have 60 days to file an appeal with the plan, and then if that doesn't resolve the issue, then 120 days to file for a state hearing. We have a link here to a publication that walks through in more detail the process for Medi-Cal managed care appeals and grievances. And then for CCS appeals, again, a little bit more complicated. The Medi-Cal hearing timeline is 90 days. There's also available in CCS a first level appeal process with the county. It has a 30-day timeline. And that's a process that the families can do the first level appeal prior to filing for a Medi-Cal hearing, or you can go directly to a Medi-Cal hearing. One note, part of sort of a continuation of flexibilities that occurred during COVID times. That timeline for the CCS appeals has been extended to 120 days through March of 2025. I did want to mention that for CCS, if you're in a whole child model county, then the appeals process more closely mirrors the Medi-Cal managed care appeal process that I talked a little bit about. Have links to a couple of, one is a really recent numbered letter from the Department of Healthcare Services outlining the CCS program appeals and state hearing process and some recent changes to that process. And then the other link is to a recent publication that the National Health Law Program put out regarding Know Your Appeal rights for the CCS program, which also outlines some of the recent changes. Next, what I want to discuss is the right to continuation of benefits, or often referred to as aid paid pending, during the hearing process. So if there is a termination or reduction in Medi-Cal services, you have the right for those services to continue at the current level pending the outcome of the hearing. So that means that the benefits must continue until the hearing decision is made. One key point is that in order to get aid paid pending, you must make the request prior to the effective date of the change. So on your notice of action that you get in the mail, it should say when the change is effective. So that request for aid paid pending needs to be made prior to that effective date, or in a situation where you don't receive the notice at least 10 days before the effective date, it needs to be made within 10 days. So if the change was effective, say May 1st, but you didn't get the notice until May 2nd, you would have then till May 12th to still be able to request aid paid pending, even though it's after the effective date of the change. And you can make that request when filing the appeal. So if you do it in ACMS, then there's a box to check that you want aid paid pending to continue. It's actually the default, so you would uncheck it if you didn't want aid paid pending. But make sure to verify that, that box is checked when you're doing the appeal. If you were to make the request in writing or over the phone, just be sure to ask for aid paid pending or continuation of benefits. Okay, so a little bit about what to expect after you file a hearing request. So you should receive a confirmation notice that the request was received and processed. Again, if you're using the ACMS system, those are usually generated, in my experience, like within 24 hours, you'll see that confirmation in the system. If you have mailed in the request, then you have to wait for that confirmation to be mailed back, which could take over a week. Again, another good reason to use ACMS if at all possible. And then at least 10 days prior to the hearing, you'll receive another notice with the date, time, and location of the hearing. I think I have this maybe a little bit later in the slides, but probably makes sense to mention now that if your hearing is scheduled for a time that doesn't work for you or is too soon for you to be able to prepare adequately for the hearing, you can request a postponement. Those postponements are generally granted. The first request for postponement is basically always granted. And then, if you want to make additional requests, you'll have to provide good cause. So an explanation of why you need an additional postponement. And if you do ask for a postponement and you're receiving aid paid pending, the aid paid pending will continue during that postponement. Now, you should also receive contact information for the assigned appeals specialist. Now, depending on the type of appeal, this will be the representative from the county, from the managed care plan, or a representative from the Department of Healthcare Services. Their name will be listed if you're using ACMS in there. It should also be listed on a confirmation notice you receive. What I suggest is that you contact that appeals specialist to try and resolve the dispute without going to hearing. See if there's additional, sort of simple questions that the county may have or additional documents that need to be submitted but weren't received. I'll say in our experience, especially for hearings involving IHSS, we find that speaking with the appeals specialist can resolve a significant portion of the issues without the need to go forward with the hearing. Now, if you've tried to resolve the issue with the appeals specialist and that has not been successful, then you're going to want to start preparing for your hearing. Basically, what you want to do is gather information to support your position. Generally, you want to start by reviewing the records that are available. See if you can get letters of support from relevant professionals. So depending on the type of service, that might be, a pulmonologist who, can provide detailed information about your child's need for in-home nursing. It might be an ABA provider who can provide an explanation of your child's need for protective supervision services through IHSS. It sort of depend on the type of support you need, the type of service at issue in the hearing. Another thing that's important is to review the statement of position from Medi-Cal. So what this is, it will be a more lengthy document that should explain in detail, more detail than what you would typically get in a notice of action, the reason that the service has been denied or terminated or reduced. And the Medi-Cal entity, be it the county, the managed care plan, or DHCS, they're required to provide this to you at least 2 business days before the hearing for you to review. This is often helpful in determining, what exactly you'll need to address in the hearing, why they made the determination to deny the service. Now, something you can do to prepare, you can draft your own claimant statement of position. If you're working, for example, with an attorney or advocate from our office, this can turn into, what we would draft as a sort of a relatively formal, hearing brief. But this can be a simple, just written explanation of the need for services. It can be kind of a narrative explaining, why you or your child need this service, what support you have for it, and just to provide that ideally for the administrative law judge to view prior to the hearing, but at the very least for them to be able to view, as they're reviewing the case and making a decision. Again, the easiest way to submit documents before the hearing is to use the ACMS system, where it's a secure system where you can upload supporting documents. But if you are doing, if you've called to schedule a hearing, when they call to confirm your hearing date, the CDSS can share with you information about how to submit documents. They have an email that claimants can use to submit documents that will then be shared with the ALJ. But just the easiest and most direct way to do it is through the ACMS system. And then again, just mentioning that postponements are available when needed. And just move along here to a little bit about what to expect at a hearing. So these hearings are relatively informal. So I know we talked to, a lot of families, I think, are imagining like, oh, I don't know if I want to go through with, a hearing, and they're picturing, like going to court on TV. I mean, I'll admit, I think when I did my first IHSS hearing ages ago, I imagined something much scarier than the 2 folding tables that were in the room when I got there. So this is a process where you can have an advocate or lawyer represent you, but you can also definitely represent yourself or your child. Each side will have an opportunity to present evidence and testimony to submit their position. Generally speaking, they'll have the county go first, and then the claimant will sort of give their side to things. Now, particularly when there's not an advocate or lawyer involved, the ALJs will often ask questions of both sides in an attempt to gather additional information and help them to make a decision. So this often turns into sort of more of a conversation. The ALJ is really trying to get the information that they need to make the decision. So they want to know, what services your child needs. In the case of something like IHSS, they want to know sort of what the experience is like at home caring for your child, and what services, you need to provide throughout the day. In a case where you're dealing with something more technical, like the need for private duty nursing, they want to know what the child's treating doctors have to say about their needs for nursing services. You are permitted to bring witnesses to provide testimony at these hearings. So again, this could be anything from your regional center service coordinator, an ABA provider, one of your child's treating doctors, that type of thing. Because ultimately what you're trying to do is show that the services that were requested are medically necessary. Now, just one quick note. So in the case of a CCS appeal, there is also the added issue of needing to explain how the services are related to the CCS eligible condition. There's sort of just a little add-on to any other Medi-Cal hearing where you're just showing the overall medical necessity. For those CCS appeals, you do need to show that it's that those needs are related to the child's CCS eligible condition. And then just end here with a little bit about what to expect after the hearing. So the hearing decision will be mailed to you. If you're registered in ACMS, it'll also be available for viewing and download in ACMS. So, of course, we always hope that the decisions are going to be favorable. But then in the event that it's not a favorable decision, there are a couple of options for further challenging that decision. If the decision is unfavorable, you can request a rehearing. And this is something that needs to be done within 30 days of receiving the hearing decision. And this is something that you can do on your own, basically with a simple written explanation of why the hearing decision was incorrect, including what evidence the ALJ failed to consider, and or if they applied the wrong standard, that type of thing. If it's successful, you'll be granted a new hearing with a different ALJ. I did want to note that aid paid pending does not continue during the time you're waiting to see if your rehearing request was granted. And then you also have the option to file a petition for writ of mandate. This is a request that a superior court review and reverse the final order. And this is something that must be filed within 1 year of the date of the decision. This is a more formal process that, while it doesn't technically require an attorney, is likely something you would want to consult with an attorney on, because it is a much more formal process. And, word of warning is that will not result in a quick resolution. It would be sort of a drawn out process of going through, briefing that in court. And that's definitely something, if you get to that stage, you want to consult with an attorney about. So that's just a little bit about Medi-Cal appeals. Like I say, hopefully, you don't have the need to appeal, or at least not too often. Just wanted to provide an overview in case that situation does arise, and some resources. So next, what I'm going to do is turn it over to Daisy Dominguez, who's going to share a little bit about the parent perspective on accessing Medi-Cal and Medi-Cal services, and an experience with Medi-Cal appeals. And then after Daisy shares with us, we will then open it up to questions. Thank you. So Daisy, I'm going to turn it over to you.
Hello, can you hear me okay?
Yes.
Okay, great. Hi, everyone. Good afternoon. So my name is Daisy Dominguez, and I am the parent slash parent advocate of a 7-year-old daughter with cerebral palsy, epilepsy, and is also nonverbal. A little bit about me. I was born and raised in Oakland, California, and I graduated from CSU East Bay with my bachelor's in criminal justice. Shortly after graduating and having my daughter, I became a stay-at-home mom and full advocate for a couple of years until I started working as a family navigator at our local family resource center from 2021 to 2023, where I helped families raising children with special needs find resources in the community. I am currently a part-time family navigator for Oakland Unified School District Special Education Department, where I help families answer questions about their child's IEP. Today, I'm here to talk to you, however, about my experience with Medi-Cal. So when my daughter was born, I myself was a Medi-Cal client, and the social worker at the hospital at the time helped me fill out the paperwork to have my daughter added to my case. My daughter was in the NICU for about a month, so I had a lot of interaction there with the social workers. Shortly after my daughter came home, I applied for supplemental security income, also known as SSI, and they informed me there that my daughter would now have Medi-Cal through her SSI benefits, and that's still true to this day. Because of my daughter's cerebral palsy, she was also able to qualify for California Children's Services, CCS, which helps pay for some of her medical equipment, such as her wheelchair, her bath chair, and incontinence supplies, such as diapers, wipes, and underpads. And my daughter is also a regional center client, and they pay for our out-of-home respite. When my daughter was about 7 months old, I applied to the In-Home Support Services IHSS program, and she was approved because she was a Medi-Cal recipient and because of her disabilities. This program has been a big help for me since it compensates me for caregiving for my daughter. I always tell parents who have children enrolled in Medi-Cal to apply for this program if your child has extensive medical needs. And do you remember the HCBA waiver that was mentioned earlier? My daughter was approved for the waiver after a 1-year wait, and I was able to obtain in-home skilled nursing care offered by a relative, paid for by the waiver agency Center for Elders Independence. Overall, Medi-Cal paired with CCS has paid for all of my daughter's hospital stays, medications, medical equipment, and incontinence supplies. I did, however, have to file for an appeal when I was looking to get my daughter's therapies paid for. I wasn't successful in getting Medi-Cal to pay for her therapies, so I filed an appeal online. I was able to take that denial letter that I received and I took it to the regional center, who was able to pick up the bill for a couple of therapy sessions since the regional center is the payer of last resort. As a family navigator, I mentored a lot of families who had private insurance, and they shared with me their struggles in trying to get services paid for by their HMO or PPO. Although I've personally never had private insurance for my daughter, I would encourage families that if your child is eligible for Medi-Cal and they have extensive medical needs, to apply for Medi-Cal or a waiver to be able to unlock other services such as IHSS, nursing, and respite services. This was just a little bit about my experience. Like I said, overall, it's been pretty good, and I've only had to go through the appeals process once to try and get therapies paid for. But I hope that I was able to give you an insight as to what kind of services you are able to have as a Medi-Cal recipient. So that is all I have. I'm not sure if anybody has any questions, but thank you for your time.
Thanks so much, Daisy. So yeah, we at this point can open it up to questions. I know, sorry, I've been sort of trying to manage the PowerPoint and notes here, and I haven't been great in getting into the Q&A, but it looks like Elizabeth's been valiantly working on that. So if anybody else has questions for any of us, we can sort of tag team on answering.
There is a new one in the chat, Anna. I'll just read it. I have a question about Medi-Cal, Cal Optima. My son's secondary insurance is Cal Optima, Medi-Cal, and private insurance is the primary insurance. We get services through private insurance. Copay for speech and OT therapies would be around $400 a month. Cal Optima mentioned Medi-Cal won't reimburse copays. And I did hear that in another webinar that copays can be reimbursed through Medi-Cal. And I don't know if you have any sort of off the top of your head.
Yeah, so I was just trying to pull up the all plan letter that provides some guidance on this issue. I will try to find the link before we end here, but I'm not sure if this is sort of your situation, but I know that there have been issues for some families when they switched from fee-for-service Medi-Cal to Medi-Cal managed care with getting coverage for copays, particularly in situations where the managed care plan is not contracted with the service provider. And the Department of Healthcare Services did put out guidance, which, like I say, we'll try to track down quickly, is that that there is a process for doing that, for getting the copays covered by the Medi-Cal managed care plan, even if they're not contracted with the provider. It's just a little bit more complicated. It looks like there are a few comments in the chat about being persistent, and it's basically, you need to work with the managed care plan to try to get an agreement in place for that. But I will try to find that guidance here and put that in the chat. No. Oh, go ahead. Sorry, Elizabeth.
No, I was going to say, are you looking in the Q&A or the chat?
I'm trying to look in both, but now I think I've lost the Q&A and I just have the chat. So
Okay.
I was just going to respond to the question about whether I'm talking about the Conlon process. So the Conlon process, I'm not talking about the Conlon process, but the Conlon process is a process where you can get reimbursement for out-of-pocket expenses that should have been covered by Medi-Cal that you paid for. And Yes, let me put, I think I should have a slide with our email, a link to our email and our intake to get more information. But yeah, feel free to reach out directly because this is one of those situations where it sort of depends on the services and the situation and what, whether it's a Medi-Cal covered service. So there is some complexity to figuring out how to get copays covered by the managed care plan. But I will drop the link for our how to contact our DRC's intake line.
Right. No, I think, thank you for the clarification. We're talking about that kind of situation where it's private insurance and a Medi-Cal copay. In the Q&A, there's a question about if you're not sure which waiver you're on. Yes, please do reach out to your service coordinator. Your health plan may or may not have that information, but I think the faster way would be to check with the service coordinator. In terms of keeping private insurance as primary, as long as possible with Medi-Cal secondary, I think it sort of depends on your situation. If you're getting care that you value through your private insurance, I would recommend that you keep it. You can keep children on longer than age 26 if they're a dependent adult with a disability. So that's something that, that's an individualized determination based on whether or not you like it. I would recommend that you reach out. There is another question about obtaining your IPP from the regional center. I recommend you reach out to our OCRA office. You could also call our intake line about getting a copy of your IPP. And I don't know.
Yeah, that's right. It's definitely something you could reach out to us about. They should provide you with a copy of the fully executed IPP. So I'm not sure. Hopefully it'll be a relatively easy thing to resolve, but definitely something you can reach out to DRC about.
There's a question about, can you have IHSS hours with the DD waiver? Yes. Those are, you can. And
a question about needing to get a denial from private insurance. So when a child has both private insurance and Medi-Cal, the private insurance is the primary payer. So Medi-Cal will require a denial from the commercial insurance plan before approving the service. This is definitely something that we run into. And Peggy, I wish I had a better answer than often, persistence in getting them to issue that denial. I will say that in certain situations, we've had luck with, instead of providing a specific denial, providing the explanation of coverage, so called the EOC. Occasionally it's called the explanation of benefits, which is something you can probably get if this is an employer-based plan, probably like to the HR department would have a link to your explanation of coverage. If you can show in there that it's not a covered benefit, then in our experience, a lot of times Medi-Cal or the Medi-Cal managed care plan will accept that in lieu of a specific denial if it's something that's not a covered service. Okay, I don't see any, and Peggy, this is definitely something you could also reach out to Disability Rights California about. I mean, we have helped people with a similar situation where they're trying to access often things that aren't covered through commercial insurance. So include like private duty nursing. If it's covered, it's often very limited, like maybe 200 to 400 hours a year, or certain medical equipment, diapers and incontinence supplies, and certain like G-tube supplies, that type of thing, that aren't always covered by the commercial plan that are covered by Medi-Cal. So certainly something we help with.
And I just wanted to add, because it came up again. If you have a child who's CCS and Medi-Cal eligible, you do not need to be on one of the waivers we've discussed today to get EPSDT nursing. And so I just really want to make sure that people know that, because that's, especially given the waiting list for the HCBA waiver, you should not have to wait to get on one of the waivers to get nursing for your child. So just a point of clarification that sometimes I think is not necessarily clear from, all of the different systems that I know parents have to interact with.
Yeah, and I just dropped in the chat, just so it's there and easier to access. I think I sent to everyone the link to our intake page, so our phone number and online intake, and that page also has a link to some of our self-advocacy resources and publications. A number of them, we linked to in this presentation, but there are others as well that may be helpful there. Okay, I think I'm not seeing anything else in the chat or the Q&A. But maybe we'll wait another minute here. Let's see. Okay, well, thank you very much, everyone, for joining us today. It was great to see so many people on. And again, if you want to discuss your individual situation or your child's individual situation related to any of these issues, please, don't hesitate to reach out, call our intake line. Yes, we would like to share the slides, and we'll just figure out the best way of doing that. Talk with our tech support folks here about how we can get those out. But we will share the slide deck with the links. So there was another question here. About no longer needing to provide asset limits to Medi-Cal. So yes, Medi-Cal has removed the asset limits. There never were asset limits for the MAGI, or Modified Adjusted Gross Income program, and they've removed the asset limits from the other programs. So it will no longer be required to provide information about assets as part of the renewal process. One thing that I know we always like to mention when we talk about the removal of the resource or asset limits from Medi-Cal, great news, but just a reminder that there was no change to the asset and resource limits for SSI. So a reminder that if your child receives SSI, there would the resource limits and asset limits still apply for SSI eligibility, but they do not apply for purposes of Medi-Cal eligibility. And yes, that essentially means that Medi-Cal eligibility will be based on income. I do recommend, if you have questions, sort of specific questions, I don't know, Elizabeth, if you could drop a link to the Health Consumer Alliance sort of main page. So the HCAs, they're sort of the best place. There's one for every county in the state. Some agencies cover multiple counties, but a place to reach out with questions about your specific Medi-Cal eligibility situation. At DRC, we're knowledgeable about Medi-Cal eligibility, but we don't really provide services related to initial eligibility for Medi-Cal, but the HCAs can walk you through sort of what that process looks like, because even though assets are no longer being considered, there are some, depending on your financial situation, if you happen to have, if those assets include, a rental property that brings in income, or, certain investment accounts that bring in interest income, you still need to sort of factor in the income earned on your asset, if that makes sense, would still be counted as income. So sort of, if you're in one of those complicated situations, still good to talk with somebody about that. But generally speaking, assets themselves will not be considered. There's no longer an asset limit.
No, Dr. Mizell, I don't think, I'm not sure. We may have been tracking that bill in our legislative unit, but I'm not aware of it. It's certainly supported. I assume it's something that you think is something to support.
Yeah, and Dr. Mizell, if you could drop in the bill number, if you have it right offhand, it's definitely something we want to take a look at. I'm sure with some Googling we can find it, but if you happen to have it right available. Thank you.
You don't eligibility criteria. Thank you. Okay, we can look at Assembly Bill 2397. With the HCBS-DD and self-determination programs, you need to meet regional center eligibility, and we don't really have time to get into eligibility for regional center services, but there are a number of different categories that make people eligible for regional centers. And I'm just dropping into the chat our rights under the Lanterman Act manual, which covers a wide variety of issues regional centers, consumers face. So that has information about eligibility for the regional center. Let's see, somebody's put in for SDP. Thank you.
Okay. Great. Well, before we kind of wrap up here, I did want to say, Daisy, did you have anything you wanted to add? Sorry, we've kind of been jumping in on these questions. I didn't know if you had anything at all you wanted to add before we wrap up.
No, I don't have anything to add.
Okay. Well, thank you very much, everybody. And again, feel free to reach out to DRC with any questions. We'll be sharing out the materials after with the links, and hope that you all enjoy the rest of the summit.